Yes, it is possible to get pregnant with low sperm count. Hi, I'm Dr. Raylee and I want to share with you 7 tips to get your partner pregnant. Now, even if your doctor thinks low sperm count is the problem, it is recommended that your partner be evaluated to rule out any potential contributing factors and determine if assisted reproductive techniques may be required. A low sperm count is diagnosed as part of a semen analysis test where factors like motility, viscosity, form, and other are also assessed. And you are considered to have low sperm count if you have fewer than 50 million sperms per millimeter or less than 39 million sperm total per an ejaculate or ejaculation. So once you are diagnosed of low sperm count, which is medically called oligospermia, there are things you can do to correct the situation. You may have to see a urologist. These are specialized doctors that deal with conditions of the kidneys, the bladder, and the reproductive organs to correct the infertility. Now, just a side note, there is a difference between low sperm count and erectile dysfunction. Low sperm count affects your fertility, whilst erectile dysfunction affects your sexual performance. So you can have a man with a very good sexual performance and yet low sperm count. And before we look at the 7 tips to get pregnant with low sperm count, I want to share with you some of the causes of low sperm count or those likely to experience low sperm count, because the solution is cause dependent. Number 1 is genetic abnormality. Here, the doctor may recommend you do a test called DNA fragmentation index. The second cause could be varicose cells, found in 16 out of every 100 men and then in 40 out of every 100 infertile men. These swollen veins in the scrotum disrupt blood flow and can overheat the testes, lowering sperm production. Number 3 is hormonal imbalance, whether it is higher or lower than the normal. And if it is a hormonal issue from the pituitary gland, then you have to see an endocrinologist. The fourth cause could be a thyroid problem, and here hyperthyroidism has been associated with low sperm counts. The next cause could be sexually transmitted diseases like gonorrhea and chlamydia, which also swells the testes, causing low sperm count. Then we have certain medications. Now, certain medications used to treat arthritis, GIT issues, anxiety, depression, infections, high blood pressure, and cancer can cause low sperm count. So talk to your healthcare provider for more information on the medication you are taking. The others could also be a testicular injury, bad lifestyle choices, radiation therapy, and environmental toxins. So once you isolate the cause, you can treat with a specific solution. Now let's look at the ways we can improve our low sperm count so that we can get our partners pregnant. And these simple tips work together and not in isolation if you want a quick and excellent result. And the first is a healthy diet. And I can't stress this enough. Always remember that you are what you eat, and it is the most important of them all. Make sure your diet is very rich in fresh organic vegetables and fruits and nuts like the almond nuts, the peanut, and the tiger nut. Especially your food should be rich in protein. The second tip is a good sleep. A meaningful deep sleep of not less than 6 hours is very helpful. There is a part of the brain that affects sperm production, and this part needs to recharge efficiently when you sleep enough. And a good healthy amount of your testosterone is produced when you fall asleep or when you are asleep. So avoid stress, and most men with low sperm count are always constantly exposed to stress triggers. The third tip is regular exercises. Studies have shown that men who exercise often are less likely to experience low sperm count. And if you have low sperm count, exercise helps your metabolism, and being overweight and obese have been associated with low sperm count. And the more you put on weight as a man, the more you deplete your testosterone and the more estrogen is produced, which has a negative effect on your reproduction as a man in terms of sperm production and even an erection. The fourth tip on the list is to reduce or avoid alcohol intake. Alcohol negatively affects your sperm production. Then avoid exposure to heat. Wear loose fitting underwears. Tight underwears can increase the temperature of your testicles, which may affect the quality of your sperm. Also avoid putting your laptop on your laps. The heat from the laptop can affect the production of your sperm cells. So avoid anything that exposes your testicles to heat. Number 6 is to review the medication you are taking. Some side effects of certain medication can affect your sperm quality. So review them with your fertility doctor or your doctor. And all you know, your low sperm count may be coming from that side effect of the medication you are taking. For example, this class of antihypertensive like the nifedipine, amlodipine have been shown to produce a negative effect on a man's reproduction in terms of sexual performance and sperm production. like impotency. Also, some men who are on this artificial medication for testosterone also reduce their sperm count when they take this testosterone medication. And lastly, avoid tobacco or marijuana smoking. This also affects your sperm production. A bonus point, it takes about 2 to 3 months to produce a brand new sperm, about 42 to 76 days to mature. So a current semen analysis reflects your environment over the past 3 months, and any positive changes you've made won't show up for several months, so you got to be very patient. It takes time. Now, there are some prenatal vitamins for men to boost their fertility, and they include the zinc, the folic acid, and supplement with studies showing potential benefit on improving sperm count and quality include the black seed, the coenzyme Q10, the horse chestnut, the L-carnitine, the Pennex, the ginseng, and selenium. If you try this for months and it's still difficult to get your partner pregnant, then our advice would go for IVF or ICSI, which is intracytoplasmic sperm injection. Now, if you found this video informative, kindly give us a like, comment, and share this with all your loved ones, especially with the men. And if you haven't seen this very important video right up here, check it out right now, and you'll thank me later. Hey, always remember that God wants you healthy. Your health, your life.